It's an honor and a pleasure to be here in this distinguished audience. I'm going to change gears a little bit. I'm going to talk about something that we haven't heard yet so far, about advanced oncologic and laparoscopic surgery in Greece. And I'm going to emphasize the point about a center of excellence, or a team of excellence, I should say, by American board-certified multispecialty experts. I spent over a decade at the Mayo Clinic training, doing my fellowship, and then becoming an assistant professor of surgery there. So when I came back to Greece, I couldn't settle for nothing but the best, which is the Hygeia Medical Complex, which I want to emphasize that is the only medical institution in Greece and one of the few in Europe that is JCI accredited, meaning Joint Commission International. This is the highest possible accreditation for a hospital internationally recognized. Within this context of this medical group, we were able to form a functional team in almost every specialty of people that have not only trained, but also worked in prestigious US institutions for several years. I'm not talking about people who went there for 6 months, 1 year, 2 years. I'm talking about people who spend years and years there working there. So having been fortunate enough to form this, this functional team, we are doing, as I said, advanced oncologic and laparoscopic surgery. I'll take a moment to give you an example about the level of our practice, although this will not be the focus of my talk. As you can see in your upper right hand side, pancreatic cancer is something lethal, and it's mostly unresectable, except you take this part of the portal vein that is very commonly infiltrated by that. We are the only team in Greece and one of the few in Europe that does that, can do that. And this has attracted people already from countries of Southeastern Europe, such as the ones that you can see, and we also receive patients already by major embassies in Athens. However, what I'm going to talk about today is laparoscopic surgery. Problems that are common, can fix quickly with quick recovery. Hernia, gastroesophageal reflux disease, and obesity. Let me talk a little bit about groin hernia. It's very common in men. We fix it laparoscopically or with a robotic repair today. It's a same-day surgery. People go home at 5 or 6 p.m. Minimal discomfort for 1 or 2 days, minimal pain. And they return to full functional recovery, full physical activity within 10 days, compared to the traditional 2 or 3 months with open surgery. Second is gastroesophageal reflux disease and hiatal hernia. 20% of the Western population suffer from that. It's because of dysfunction of the sphincter between the esophagus and the stomach, and it severely interferes with quality of life, causing heartburn, food reflux, increasing the risk of cancer of the esophagus. People need continuous use of medication, but the medications treat only the symptoms, not the cause, never the cause. And they also need endoscopy annually. So what do we do? Again, with laparoscopic and robotic technology, we reconstruct the dysfunctioning sphincter, treating the cause, not only the symptoms, allowing the patient to free himself or herself from medication, annual endoscopies, eliminate the risk of cancer. It's again, same-day surgery, and people return to full activity and no diet restrictions very quickly. Third is morbid obesity and weight loss surgery. 1 in 15 people in Western countries have morbid obesity. Morbid obesity has a huge impact on public health and health cost. Why? Because it increases 7-fold the risk of cancer in breast, uterus, ovaries and colon, and 8-fold increased risk for heart attack and diabetes. So it has a huge impact, as I said, on medical expenses, and it's not a cosmetic problem. It's a very true medical problem of the highest significance. Surgery is the solution, according to the published National Institute of Health in Bethesda, Maryland, back in 1995. There are several procedures, but we do individualize these procedures. Again, they can be done laparoscopically or robotically. It's same-day surgery or one-night stay, and then, again, people return to full activity. People who have this surgery regret, all of them, regret one thing. They regret that they hadn't had this operation earlier. This young girl, to your right, bottom side, 22-year-old medical student, she said to me, I would have this operation every year if I had to. It changed her life so much. So, in order to respect the time and be brief, in conclusion, our team offers laparoscopic same-day surgery for very common but significant conditions. Procedures that allow patients to quick recovery and full activity very quickly again. This is done by American board certified experts between 7 and 13 years or 15 years of work in major US institutions. In top-notch hospitals with JCI accreditation, I emphasize that. Working in state-of-the-art technology, using state-of-the-art technology, and offering a patient-centered care. And all of that at a 70% lower cost, at least compared to the United States. Thank you very much.
Grigoris Tsiotos, ογκολογική και λαπαροσκοπική χειρουργική.
Δύο λόγια για τη σημερινή εκδήλωση.
Είναι πάρα πολύ πετυχημένη η εκδήλωση. Είναι μια ευκαιρία να δείξουμε σε ένα διεθνές κοινό ότι έχουμε όχι απλώς την Ελλάδα ως έναν καλό προορισμό για διακοπές, αλλά για πολύ υψηλού επίπεδου ιατρικές υπηρεσίες που σε ό,τι αφορά τη δική μου την ειδικότητα ξεφεύγουν από τη γονιμότητα και την πλαστική χειρουργική, την αισθητική χειρουργική, η δερματολογία. Είναι σοβαρή χειρουργική που ήδη μας έρχονται ασθενείς από ξένες χώρες και θα θέλαμε να επεκτείνουμε αυτό το δίκτυο, το referral, στο Ηνωμένο Βασίλειο και σε άλλες χώρες. Είναι πολύ πετυχημένη εκδήλωση.
Ευχαριστώ πάρα πολύ.
Να είστε καλά.